To the northwest now, where Health MEC Madoda Sambatha says striking Nehawu members are giving her department no option but take disciplinary action against them. Refiloe Seboko has more from the Tshepong Hospital in Klerksdorp.
The Northwest Province is one of the 5 provinces in the country that is being affected by the Nehawu strike, and I'm joined by the MEC of Health in the Northwest Province, Madoda Sambatha, just to get a sense of how it has affected services in the Northwest. Thank you so much and welcome to Newzroom Afrika. When we talk about the Nehawu strike, how has it affected healthcare services in the province when we are looking at issues of intimidation, incidents of blocking entrances to the healthcare facilities in the province?
As you would recall, like all other provinces, what has happened in our province, as the days were starting, intimidation was very high, especially in Dr. Kenneth Kaunda, where we are, Klerksdorp, Tshepong and Vedrand. And then it was very high in Jomurulong and later in Taung, very high in Lihurutsi and then Breds and Moses Kotan. But we have engaged now 2 days ago, and we had explained to them there's no reason for a strike on wages to have an impact on access to services, because both are constitutional rights. As workers have a constitutional right to strike, community members have a constitutional right to access services. The way they were doing was that they were taking over operation of gates and then blocking in and out access. Since we engaged with them, I think that we must even say that openly, that they've worked with us in terms of telling everyone that nobody has a right to close a gate in and out. Nobody has a right to intimidate those that have decided to come to work. Nobody has a right to impede access for patients for health care delivery, and nobody has a right to remove those that are in the wards. As we speak, the situation has drastically changed. Our facilities are no longer chained. They have been opened in gates. Our facilities are no longer no-go areas for patients. Our facilities are no longer no-go areas for all staffs that are prepared to work. This is because everyone else must always respect the right of access to care. What you also get as a surprise is that part of their demands is an increase in medical scheme. What it means is the people who are blocking a gate themselves have no interest to be serviced by the same facility they are, because their intention is to get a medical aid and go to private providers, and we can't allow people who access government services to then be subjected to torture by people whose interest of service is not the same government services.
Thank you so much for your time. MEC of Health in the Northwest Province, Madoda Sambatha, just clarifying some things there, indicating that situation is a bit calm in other facilities in the Northwest Province following that strike by Nehawu members, and also indicating that disciplinary action will be taken against those who are found and to be wrong and participating illegally so in this strike. For Newzroom Afrika on Channel 405, I'm Refiloe Seboko in Klerksdorp in the Northwest.